It is a pleasure to have the opportunity to introduce our distinguished guest speaker, Dr. Walaa Sabih. Dr. Walaa Sabih is a certified nutritional practitioner, a certified holistic cancer practitioner, and a proud member of Canadian Association of Natural Nutritional Practitioners. As a physician and a breast cancer survivor, Dr. Sabih often gets asked, "You're a doctor, so why holistic health?" Her answer is always, "Like all physicians, I observed over time that diet, lifestyle habits, coupled with the environment and sometimes genes eventually impact health." Dr. Sabih's answer is the role of allopathic medicine is undeniable, yet there remains a vital missing component, healing. Holistic health naturally allows the body to heal inside out, overcoming disease, and this answers why. Today, Dr. Walaa will speak about complementary and alternative therapies used breast cancer community-based findings. Welcome, Dr. Walaa Sabih.
Thank you for having me, and it's a pleasure to be with you. Today, I'm going to be talking about complementary and alternative therapies, better known as CAM therapies generally, and then I'll focus on some findings, community-based findings we have found among breast cancer survivors who use these therapies. Now, the objectives for today are, I'm going to define some of the terms so that we're all on the same page. I'll just throw a light on the historical origins of CAM therapies, and I'll describe the different types of complementary and alternative therapies. Then we'll review some of the reasons why people use them, and then I'm going to share some of the findings, a summary actually, of some of the findings for 2 community-based breast cancer outreach products. Now, definitions that we're going to use in this presentation is that mainstream medicine is the same as allopathic medicine, and it is our evidence-based conventional medicine, while complementary therapy is non-conventional therapies which are used with conventional medicine, such as acupuncture. Alternative therapies, however, are non-conventional therapies which are used instead of conventional medicine, such as the Budwig diet, which is used for cancers, and Gerson therapy, which is mainly used for gastrointestinal cancers. Nowadays, integrative medicine is trying to combine between these 2 modalities. It combines conventional medicine like drugs and surgery with safe, what they have deemed as safe complementary therapies like yoga, meditation, and acupuncture. Let's see the history of these and where they originated from. So the oldest is actually from the Alaskan natives. It's about 10,000 years old. Ayurveda originated in India, and it's about 8,000 years old, while traditional Chinese medicine originated in ancient China, and it's about 5,000 years old. The newer ones are prophetic medicine, which originated in the Arabian Peninsula. It's about 1,400 years old, and homeopathy originated in Germany, and it's about 1,200 years old. Now, if you take a look at them, you're going to realize that all of them have used some form of diet or plants or herbs, but they differ in some of the modalities they used. For example, Native Americans used to use smudging or storytelling. Ayurveda uses body manipulation, yoga, and exercises. Traditional Chinese medicine also uses acupuncture and Tai Chi. Prophetic medicine used all sorts of things, mainly prayer and ruqya, cupping, as well as other plants. And homeopathy used plants, minerals, and animals, parts of animals that were developed into sugar pellets or into oils. As for the classification of CAM therapies, there are multiple classifications if you search the literature. However, I prefer to use the National Cancer Institute classification, and it classifies them into 5 main categories: mind-body therapies, biologically based practices, manipulative and body-based practices, energy healing, and whole medical systems. So let's take a short review about each one of them. Mind-body therapies focuses on the mental aspect, breathing exercises, and it teaches the patient specific body movements. And the whole idea is to help the patient relax, both body and mind, and this is very important. Why? Because in cancer, proper healing from cancer cannot occur when the patient is in sympathetic overdrive. They have to switch from sympathetic overdrive to parasympathetic mode, which is the rest and digest. So if we take a look at these mind-body therapies, we have meditation, biofeedback, hypnosis, yoga, and Tai Chi. All of these, if you review all of them, you're going to see that they all allow the client or the patient to relax, both body and mind, but they use different modalities. For example, yoga uses meditation and specific poses. Meditation itself uses mantras and visualization, which is a practice I have tried, and it is one of the most relaxing modes of mind-body therapies. Tai Chi uses slow sets of body movements with controlled breathing. Then there's also creative outlets, which utilizes art, music, or dance, and the whole idea is to make the patient feel much better. Biologically based practices, however, use things which are found in nature, like vitamins or dietary supplements, and it's usually a combination of minerals with herbs and vitamins. Botanicals, which is herbal medicine, they use part of the plant or the whole plant. The roots may be used for something, the leaves may be used for something else. And then there is also spices like curcumin and garlic, and these holistically are one of the most potent anti-cancer agents. Then there are special foods and diets like the Budwig diet, metabolic balance to put the patient in ketosis, and many other types of diets. There's B17 and many diets concerning the biologically based practices. Manipulative and body-based practices, these work on one or more parts of the body, like massage therapy, chiropractic therapy, and reflexology. Massage therapy is very well known. I'm sure all of us have gone for a massage, and you can feel how relaxed you become during a massage. Cupping is also used in massage therapy. Chiropractic therapy, and we're going to see one of the patients who used chiropractic therapy. It manipulates the skeletal system in general, and reflexology is built on the basis that if you press on specific pressure points in the palms of the hands and the soles of the feet, that is going to reflect on different parts of the body or different organs. Energy healing is another modality, and this believes in the fact that there is a continuous energy flow through the body. And this energy flow can be interrupted by something as simple as a hypodermic needle. And the whole goal is to try to balance this flow. So we can use, there is Reiki and there is therapeutic touch. And the whole idea is to try to allow the energy to flow from the practitioner's hand onto the patient to help the flow of energy stay in one direction. Whole medical systems are healing systems and beliefs. So Ayurvedic medicine tries to cleanse the body first and then restore the balance between the body, mind, and spirit, or the soul. Some people call it the soul. Traditional Chinese medicine tries to restore the balance between the yin and the yang. And naturopathic medicine or holistic therapy, which is what I practice, we use natural agents. We do not prescribe drugs or surgery or advise surgery, but if the patient does choose to use these, we do not interfere. We use herbs, we use supplements, nutrition, and if the patient chooses to use acupuncture, aromatherapy, they are very free to do what they like. The main thing is to search for the root cause of disease. The barrel effect, which was first mentioned by Dr. Doris Rapp, I believe is something which is very important. And I don't know if some of you have heard about the barrel effect, but it's a metaphor, and they simulate the body to a barrel. Every one of us is born with a barrel depending on what our mothers have been exposed to during their life and while we were in utero. And this slide shows you a barrel, and it's showing you the different physical agents which could be input into the barrel, filling the barrel gradually. This is just the physical agents. We also have mental factors which are going to affect us, like stress, like toxic people or toxic environments. Everyone's barrel has a limit to its capacity, and once that barrel is filled, it starts to overflow. When it overflows, the patient is going to develop symptoms that doctors find very difficult to interpret. And actually, when they do investigations, they do not find anything abnormal, but that is the beginning of what we call dis-ease, and this is an unhealthy body terrain. Why is that important? Because holistically, cancer to us is not a disease. It is a symptom, of imbalance in the body. And it results when you have an unhealthy body terrain. Cancer will only grow in an environment that allows it to grow, and it's usually hypoxic and acidic. And when the immunity is going to be affected, that is when cancer thrives. So holistic therapies tries to search for the root cause of disease, and we try to cleanse the body and heal it inside and out. And we do not focus simply on the condition or complaint, and it follows specific systems. Why do people use complementary and alternative therapies? There are many reasons you can find when you search the literature, but I like the ones that were mentioned by Cancer Research UK, and it actually summarized them into these following reasons. First of all, and most important, is that these therapies help the cancer patient feel better. It helps them relax and it reduces stress. And remember, they need to be in parasympathetic mode to heal from cancer. It also reduces the symptoms of cancer like pain or the side effects of chemotherapy, and it gives the patient a feeling of control. It empowers them. They're more proactive in their healing process. And they also feel that these natural healing therapies are not toxic compared to the chemotherapies that they use and the radiotherapies. And they showed me their black fingernails and the burns that they had on their skin. Other reasons was simply the comfort of touch, of talking, and the time spent while you are under these therapies. It helps them to become positive, and they feel that there is hope, because a lot of them feel that they are hopeless. All of these positive feelings boosts immunity, and some of them use it, unfortunately, because they're looking for a cure because their conventional therapy no longer is able to cure their cancer. I'm going to throw a light now or summarize some of the community-based findings we had in 2 different regions. One of them was in the UAE, and I'd like you to pay attention to the proportions. 30% of the healthy screeners, depending on the culture and tradition in the UAE, and these are UAE nationals, said that the first thing they would do was visit a local healer who had learned from their forefathers. Their first line choice would be to use cautery to try to decrease the size of the tumor. And then after that, they would go to a herbal healer, so that they would use herbs. And then they would ask their mothers and sisters. And if their mothers and sisters decided that that was enough, they were not going to see a physician. And that is something which is very important to consider and be aware of as a physician. While in Peterborough, Canada, we interviewed 35 breast cancer survivors. Once again, look at the proportion. 37% admitted that they were using at least one type of non-conventional therapy. I believe they were actually more than 37%, because when I asked them the question, they would hesitate. And then they would ask me, will my oncologist know? And I told them, no, they won't. And then they would hesitate again. And some of them would continue and confirm that they used, and the others would say, no, I didn't use. But look at the reasons that they gave. Many are doing it anyway, and I believe this is a very strong statement. Physicians need to be aware that patients will be using CAM therapy, whether they tell them or not. It also gave them positive feelings of hope, because they felt that in cancer care, there was a lot of hopelessness, and they felt that there was loss of empathy from the oncologists and the nurses in cancer care. The CAM therapies they used were acupuncture. This is just a summary. Acupuncture, they used it for chemo, nausea, and anxiety. One of them visited a chiropractor for tingling sensations she developed post-chemo. Most of them used yoga to help them relax and for mindfulness. Massage therapy, obviously, for relaxation, and one of them used it for lymphedema. One of the Aboriginals used a sweat lodge and a jingle dress, and both of them were the sweat lodge was to sweat out toxins, and the jingle dress was to help her feel better, and she actually believed that it healed her. Manuka honey was used by one of the ladies, and she believed that it helped to support her immune system. And another one used cranberry capsules because she developed repeated UTI and she didn't want to keep using antibiotics, and the cranberry capsules actually controlled her symptoms and her condition. Turmeric capsules were used for joint pain, and one of the patients who had recurrent cancer, not just breast cancer, but she also developed thyroid cancer and colorectal cancer, she used IV vitamin C, mistletoe, and anti-cancer diets. And one of them used natural remedies. She didn't say what they were, but she said it allowed her to sleep better. She had much better energy. She didn't develop mouth ulcers, and she didn't have, as she described, neutropenia fever. And the healthiest of all of those 35 was a lady who was using naturopathy as a total alternative to chemotherapy. And she looked like the sun had kissed her face. And I saw her, she was a stage 4 cancer patient. I saw her 4 years after her diagnosis of stage 4, and she was given just 6 months to live. And she was only using that specific tea. This is a jingle dress, and these little things that are hanging down from the dress actually are bells. And when they dance, it makes a very nice jingle sound. And I've put in this link so that if you'd like, you could visit that and see what a jingle dance is. To conclude, CAM therapies are very old and they are very commonly used by communities. There's some literature will say that it varies between 17 to 74% of patients use CAM therapies. So it's very important that people are aware of this. Why? Because patients want to play an active role in their own care. Some CAM therapies have been carefully evaluated and proven to be safe, like yoga and meditation, while others may be harmful. But physicians, I think the most important point is that physicians need to have an open mind, have an open communication with their patients, especially with cancer patients. They need to actively listen to them and proactively work with them. And at the same time, be aware of the cultural or traditional CAM practices in the geographical area that they are practicing. Thank you very much for listening, and I am open to any questions you have.